Hi, I'm Dr. Ben Newman. I study coronaviruses, and let's try to answer another one of your questions. All right. Kareen asks, "Hi, Dr. Ben. Quick and simple question. Come on, I like those. Yeah. Let's see. Any views on the vaccine currently being dished out like hotcakes in Europe?" All right. Yeah. Europeans don't really know about hotcakes. Isn't that weird? Yeah. Like the English call them Scotch pancakes, I think. Yeah, as if Scotland, I don't know, is the only place where you can get them. And I think in other parts of Europe they would call them like American pancakes. Yeah, they're way into crepes over there, so they're dishing them out like crepes, and that's all right. Yeah. Let's see. I understood that a proper vaccine would not be identified, tried, or suitably tested until summer 2021. That's the way it looked, and yeah, so I guess all right. Let's finish the question, and then let's finish the question before we answer it, shall we? That seems better. Yeah. Okay. So what happened? Did somebody have a brainwave? Is this for real, or are we being used as a ginormous testing lab? Legit question. Yeah. I think no, but yeah, we'll get to that. And apologies for the sarcasm and skepticism. No, these are good questions. These are what everybody's asking, and so let's try to do a good job of answering them. All right. So how long does it take to do a clinical trial? Well, to do a clinical trial for a new vaccine, the rules are you've got to have the vaccine in people for 2 months. And this is for a thing called emergency use authorization. Emergency use authorization is not full-on approval, although it is sometimes sold as that because you are able to get a vaccine, and what is that if not approved? It just means that it's something that can only happen during an emergency, and it's something that goes away if the emergency is done and is reviewed on a rolling basis. So every couple of weeks, they got to get a new batch of test data together, show it to the regulators, and the regulators say, should we continue letting you do this or not? Yeah. And if at any point the answer is no or wait a minute, then yeah, boom, pause the entire thing. Emergency use of authorization pulled, and yeah, you got to show, really why this thing is safe, and you got to convince some very skeptical people at that point. So, yeah, how long does it take? Well, yeah, so you got to be running your phase 3 trial. The rules are for 2 months. And so, theoretically, you ought to be able to do a phase 1, and yeah, about 2 months is about right for each of the phases. So, 2 months plus 2 months plus 2 months, you should be able to get any new vaccine in 6 months. The part that takes all the time is you've got to get doctors together. You got to get permission from large institutions that have reputation and money and their entire future on the line. If you mess up, you've got to get all these people convinced, and then you got to enroll people. You got to find people that are willing to join. You got to have all kinds of statisticians that are there doing this. Any kind of good, properly done study has got to be placebo-controlled and double-blinded, let's say, which means that the patient has no idea what they're giving, the doctor has no idea what they're giving to the patient, and nobody's going to know except the statistician who unblinds, like uncodes the patient, uncodes, they got XJ421, whatever, like, oh, what's that? Yeah, that was, salt water, yeah, or that was the vaccine. And so, yeah, it's the people parts, the regulatory parts, lining up enough money, because you and I have been to the doctor, but when we're talking about vaccine trials, they're talking about sending 45,000 people to the doctor every single week, and like, what doctor is already not doing something and has a bunch of free time and is willing to do this? It is almost entirely because governments have been shoving money into this thing like whatever they feed to foie gras ducks in the old days. Yeah, basically stuffing it as full as it will go. And everybody's focused on this. Hospitals have closed down a lot of the elective surgery stuff. And so there are people that used to have other things to do that now have only COVID things to do. And with that amount of attention and money and just everybody watching and saying, where is my vaccine? I've been waiting. Yeah, this shows you what can be done. And from a scientific point of view, it's been a little on the slow side, I gotta say. I think all of the vaccine ideas that we're seeing coming to approval right now, about a year after COVID, are things that people thought up in, I don't know if it was the first day or if it was the first hour of the first day of COVID. These are things that people have been trying out for 20, 30 years. They know pretty well how to do them, how to put all the parts together. They've done it over and over and over again in mice. They just haven't got to a situation where it is economically feasible to do these giant tests in people and where it's worked. And so this is, kind of the very tail end of a very, very long train that's been pulling through the station for the last 30 years plus. And, so science moves glacially slowly, I would say. And, but unless you are reading the Journal of Immunology, which I usually don't read, I'm more a Journal of Virology guy, you are not going to see this. You're just going to see that, whoa, somebody had an idea. It's a new virus. How could they have done any sort of pre-work on this virus? And then, boom, they've implemented the idea and it's gone all the way through. The pre-work was trying this sort of strategy against everything for a lot of years in a lot of different laboratories, and tweaking tiny things. So the Pfizer vaccine, they tweaked the U nucleotides. Instead of uridine, they made them pseudo-uridine because it's supposed to give less of an immune response. And there's 2 papers that say it works that way. 1 paper that says it doesn't make any difference at all. And so I don't know. Jury's out on that, I think. But it's not any worse than the regular version. And they've been tweaking the way you deliver this. The NIH, the NHS have been putting out calls for funding for projects like RNA vaccination and lipid nanoparticle delivery of drugs and RNA and DNA and protein and what have you. This stuff is old. It's been around for years. So that's the rest of the iceberg. Yeah. What we're seeing here in COVID, that's the tip of the iceberg. And we all know, the tip's nothing. Yeah. So that is basically what's going on. And I think with those other studies, the one thing they always agreed was that there's no real danger in this type of vaccine. This is like the least dangerous of the types of vaccine. There are certain things you can give in a vaccine. Like if you're giving protein, you sometimes have to add something else to make the immune system recognize the protein. Get the dose of that wrong, you can have bad consequences. This thing is just a vaccine with RNA. It's basically information in the form of RNA. And it falls apart on its own within a few hours of actually entering the body. It's just a very short-lived, very temporary way of giving the immune system the best education that you can. And honestly, I'm really glad that it works. I was never particularly concerned that it would have strong side effects of any kind because, I don't know, there just isn't anything biologically that complicated or new or interesting about this vaccine. In terms of the science, it's kind of dumb old science that, just done at very large scale. It's something that was expensive to do before now. And advances in technology have brought this to the point where we can actually now do it on a scale that's bigger than, some guy with 5 mice in a lab. And that's, I think, the real story and the real advance here is the technology behind making tons of RNA on command, getting it really clean and nice, and just doing that at scale like never before. And that is really cool and really nice to see. So that's how I see this thing anyway. And they're good questions. But as far as I'm concerned, I think this one's going to be really safe. But I'm a scientist. We got to keep an open mind. We got to keep assessing the data as they come in. And so I'm going to do that. And if something changes, I'll make another video about that. Or you can ask another question. Yeah. Thanks very much. This has been Ask Dr. Ben.